Okay, now we're going to talk about health and adolescence. Adolescence is where habits are developed. Health depends primarily on these habits, whether they're good or bad. Some ways to reduce bad behavior is by encouraging good behavior, which could be encouraged by participating in school-related activities such as sports, availability of positive community resources such as clubs, as well as having a secure attachment to their parents. Risk-taking behavior increases through ages 10 to 15 and then declines through adolescence. 18-year-olds are more impulsive and less future-oriented than their younger counterparts. The more resources there are in a community, such as youth activities, the less likely adolescents are to engage in risk-taking behavior. Communities with more social capital, such as churches and high school diplomas, equals, for the most part, less risky behavior being exhibited, such as gunshot wounds, teen pregnancy, alcohol and drug treatment. Other influences also seem to be siblings, either good or bad, as well as whether they do or do not have good grades. Neurobiologically, the prefrontal cortex that is involved in the reasoning and decision-making matures much later than the amygdala, which is the main structure involved in emotion in the brain. This explains how young people have trouble controlling their risk-taking adventures. A solution might be to limit opportunities for immature judgment, such as high cigarette prices or raising the driving age. It's important for teachers, parents, and mentors to monitor the behavior of adolescents. Their lack of self-regulatory skills can make them vulnerable to negative outcomes. Another factor that influences youth health is the way they access health services. Poor organization, lack of confidentiality, and reluctance on the part of healthcare providers to communicate with them about sensitive issues seem to be the main problems. Causes of death in adolescence. Accidents account for almost half of all deaths in adolescents from ages 15 to 24, and 3/4 of that number are from motor vehicle relating to alcohol, speeding, or lack of driving experience. This is then followed by homicide and suicide. Emerging adults ages 18 to 24 have twice the mortality rate as adolescents. They're more likely to be obese and have mental problems and can appear healthier than they are. This becomes visible later in life because it's mostly through habits they develop by relying too heavily on physical stress or abuse for pleasure. At one point, their body was able to bounce back from easily. In regards to nutrition, US and British adolescents were more likely to eat fried foods and less likely to eat vegetables. Stress tended to be put on eating between meals, but it should be put on food choices. Exercise and sports. Most adolescents are not getting enough exercise. At the ages of 13, approximately, is when it starts to decline, especially in American girls. Some positive benefits that come with exercise are higher self-esteem and confidence, lower risk of being overweight, type 2 diabetes, lower on average of alcohol, cigarette, and marijuana consumption, as well as more electrophysiological brain profiles and a higher level of task preparation and response inhibition, which basically means it's going to benefit their academic achievement because that all relates to attention, memory, effortful, and goal-directed behavior, as well as creativity. They also can have a higher quality of sleep, and it can act as a stress buffer and can regulate mood and improve relationships. Sports also have benefits. They can help you learn to work with others, and when you're involved in sports, you're less likely to engage in delinquent risk-taking behavior. Sometimes sports involvement can be negative, with intense pressure by parents and coaches, and it can also provide as a distraction from academic achievement. Also, competitive sports have correlations with self-centeredness as well as anxiety. The roles of family and schools. When parents get children involved in physical activity between 9 and 13 years old, they're more likely to continue it throughout their life. Also, parents must be aware of the amount of time spent in front of TVs and computers for the health of their adolescent. Sleep. Adolescents get up later and go to bed later. This could be linked to changes in the brain. There's a strong link between lack of sleep and adolescent problems. Starting school later has helped discipline problems, illness, and depression in adolescents.